All right. Good evening, everybody. This is Adrian. This is Baso. Today, we're going to show you some core exercise you can do into your second trimester. She's 6 months pregnant. So when you're 6 months pregnant, you can't lay on your stomach and you can't lay on your back. So we're going to show you some exercise sitting on this BOSU ball, and you can do at home. So for the sake of the video, we're not going to do nothing heavy extreme. We have a 6-pound medicine ball, and we're going to start off with the core exercise. We're going to do a couple of different exercises. We're not going to do a whole lot of reps, so we're going to try to get some, show you some different variations that you can do. So we're going to keep the reps low, but when you're doing it on your own, you can do a certain set like 15, 20, 25. It just depends on your level of where you're at as far as your level of exercising you're at. But make sure you get a clearance through your doctor saying it's okay to do these exercises. So the first exercise we're going to do, you can either do your feet straight, which is a little easier, or you can bend your knees. So we'll do two versions. So we'll do the straight. We're going to do windshield wipers. We're going to take the medicine ball and straight arms and alternate. We're going to do, we'll say 20. 1, 2. So we'll count like this: 1, 2, 3, 4. We'll do 10. So that way, 10 reps. So we'll do the straight leg version. So she'll do 10, 5 on each side. This is the modified version, which is a little easier to do. The boozy ball creates instability, so you can do it on the floor if this is too difficult for you. But if it's not, you can sit on the ball and do it. So the modified version of this is sit on the floor. So we're going to do the little bit harder one for the next one. So bent knees. So when you bend your knees, it becomes a lot more difficult. See? You saw it? But it's a lot more challenging. So there's 3 variations. You can do it on the floor, and this works your whole core area, your obliques, your whole deep transverse, all the core muscles. All right. So you can do those. So the next one we're going to go to, she's going to go into the circles. We're going to do the modified version, straight legs, and we'll do the bent. Let's do 10 circles. If you can't quite do the big circles, do the little circles. So she's going to go 10 each direction, clockwise and counterclockwise. And the straight leg version is a little easy. But if you can't do those, sit on the ground and do it on the ground. So either way, we're giving you some core options that you can do from at home to make sure you stay in shape. So the more challenging one, we'll give a little time to rest, is the bent knee. So the bent knee is a lot more challenging. So let's do 10 and 10. Bent knee, you see? All these core exercises could be do seated position on the ball. So she's going to go 10. And the key is not to go too fast. The slower, the more challenging it is. So she's going 10 back the other direction. Good job. Now the next one we're going to do is seated ball throws. We'll do the modified version, straight legs, and then we'll do the more advanced one. So the ball throws, we'll just do 10 throws on each hand. 1, 2. So the higher you throw it, the more challenging it is. If you've never done this, you can start off with just raising it up and down and then go into the throws. It don't have to be very high, just challenging. Again, the higher you throw it, the more challenging it is on your core. So this is the modified version. Again, all these exercises could be done at home sitting on the BOSU ball. So we'll give her a few seconds to catch her breath, and then we'll do the bent knees. Again, the bent knees are a little bit more advanced. If you can handle it, try it. We're going to do 10. So during this whole process, her feet is not touching the ground, whether it's the straight leg modified version or the bent knees modified, bent knee version. Both of them, the feet is off the ground. Again, we're just using a 6-pound ball. If that's too challenging, you can go down to a 4-pound ball, medicine ball. If you want a little bit more challenge, then you can go to an 8-pound or 10-pound medicine ball. Just make sure the doctor clear you for a certain weight, and always listen to your body. So the next one we're going to do is 2-hand throws. So the 2 hands, you can throw it a little higher, so we can keep the same ball. We'll do the straight leg version. Throw it with 2 hands. Throw it as high as you can, and then we'll do the bent version. See, can't even see the ball. It's not even in the camera. See how high she's throwing it? Well, you don't know how high, but she's throwing it pretty high. 10 throws. Good. So rest for a few seconds, and then we'll go into the more challenging one, as with the bent knees. See, the bent knees are more challenging. Good job. So we already showed you 4 different exercises that you can do. Windshield wipers is 1. Circles is 2. Single hand throws is 3. 2-hand throws is 4. And then we'll give you one more. She'll sit on her knees on the ball, and she'll do alternating halos. Now, she'll do the modified version. She'll just do 10 alternating with her feet touching the ground. So her feet touching the ground, her knees on the ball. So this is the modified. Go ahead and do 10. Make sure the ball goes behind your head. And again, her feet is touching the ground, and her knees is on the BOSU ball. This actually helps your shoulders too, not just your core. So she's going to do 10 reps. So 5 alternating each side. At home, you can do 20 or 30 reps alternating. If you want to just follow along this video and do 3 sets of this, that's good too. However you want to do it. So the more advanced one, her feet is not touching the ground, and she's going to do the halos again. If you have knee issues, then you may not want to do this version. You can just stand up and do the halos. And if you want a little bit more challenge, you can go up on the weight with the medicine ball. You can go 10, 12, 15, 20-pound medicine ball. Really strictly up to you what you can handle. And the key is listen to your body. All right? So we gave you 5 core exercises, and we gave you some modified versions of it. And like I said, if it's too challenging for you, you can always sit on the ground to do it. So the ground is easier. Sitting on the ball a little bit more challenging. Straight leg is like modified, and the bent knees is more advanced. So 3 different versions. Try it. If you're looking for some core exercise that protect the baby and protect the mother, those are core exercises you can do at home. So thank you, Adrian.
Thank you.
End of this month should be 7 months, and we'll still continue to put videos out for her pregnancy. It's definitely been challenging for her as well as me. I learned a lot during this pregnancy. I don't have kids of my own, so she's teaching me a lot. So
You're teaching me too.
So we're really helping each other, and like we're really like listening to her body, listening to the doctor. And the biggest thing is include mobility in all these exercises. Mobility is key. If you have any questions about her journey with the pregnancy, feel free. Leave us a comment. We love comments. We know, well, we do get back to every comment. Sometimes it take a little bit longer, but we do respond to every comment. So don't feel like you can't leave a comment and we won't respond to you. So feel free, leave a comment, whether it's, we prefer positive, but you know, leave us a comment and we'll read it and we'll respond as soon as we can. Thank y'all for tuning in. If y'all have any questions, leave us a comment. Thank y'all. Good night.